Good morning, students. Today we are going to discuss about the urinary bladder. Okay, so I have a specimen of urinary bladder in my hand. You can see it here. This is male urinary bladder. I will tell you why it is male urinary bladder. What are the features of the urinary bladder in the male? Okay, first of all, you can see here the urinary bladder has got an apex. It has got a base. This is the base. This is the apex. It has got a superior surface. It has got two infralateral surfaces. These are the infralateral surfaces, and this is the posterior surface. So once again I will tell you, it has got an apex and it has got a base, and it has got four surfaces. One is the superior surface and two infralateral surface. There is one infralateral surface here and there is one more infralateral surface here. Okay, and what about the borders? One is the anterior border. This is the anterior border, and then we have two lateral borders here, and then we have one posterior border, here. This is the posterior border, this is the lateral border, this is also the lateral border, right and left lateral border, this is the posterior border, this is the anterior border. So this is the anterior border. Okay. Now what are the parts of the urinary bladder? The parts of the urinary bladder are apex, base. Between the apex and base you have the body. This is the body. Okay. So you have the apex and the base, and between the apex and the base you have the body of the urinary bladder. Okay. And then lower part you have the neck of the urinary bladder. So lower part of the urinary bladder is called the neck of the urinary bladder. Surrounding the neck of the urinary bladder you have the prostate gland. So prostate gland is situated around the neck of the urinary bladder. This is the prostate gland. You can see this is the prostate gland. So you can see this is the prostate gland. It is walnut size and walnut shaped. Okay. It is inverted conical shape. Okay. The base is above and the apex is below of the prostate. Now, what are the other things we have to know about the urinary bladder? Now, I have already told you that it has got four borders: anterior border, two lateral border, one posterior border, and surfaces: superior surface, infralateral surfaces, two infralateral surfaces separated by the anterior border, and then you have a posterior surface or the base. Now, you can see there are two ureters. You can see the ureters here. You can see the ureters. So the ureters are opening into the urinary bladder. So they are entering the urinary bladder and ultimately they will open inside the urinary bladder. These are the ureters. Okay. Now look at the posterior surface. There are some features which you have to appreciate on the posterior surface of the urinary bladder. If you see the posterior surface of the urinary bladder, first of all, first structure what you see is the ductus deferens or vas deferens. This is the ampulla of the ductus deferens or vas deferens. Here also you can see the ductus deferens, the ampulla of ductus deferens or vas deferens. Now below it we have the seminal vesicles, the gland that is the seminal vesicles. So in this urinary bladder you have prostate, you have ductus deferens, you have seminal vesicles. So all these three structures are present only in the males. So this is a male urinary bladder. It is not a female urinary bladder because you have prostate around the neck, and on the posterior surface or the base of the urinary bladder you have the ductus deferens and the seminal vesicles. Okay. So you can see what is the shape. It is tetrahedral. The shape of the urinary bladder is tetrahedral. Okay. So it has got four sides. You can see that. Okay, one is the superior, then the two infralateral, and then the base. You should know that the base of the urinary bladder is called as sometimes the fundus of urinary bladder. So some authors refer the base as the fundus of the urinary bladder. So this is actually the posterior surface of the urinary bladder. Okay, and the prostate is very well clearly seen and felt. It is a very hard structure. Prostate is a hard structure. Okay. So this is with the urinary bladder. Now let's see. Now one more structure I want to tell you here. Now to the apex the urachus is attached. Okay. To the apex the urachus is attached. Now we'll see the interior of the urinary bladder. If you see the interior of the urinary bladder, I will show you a different specimen here. This is also urinary bladder. You can see once again. This is the apex. This is the base, this is the superior surface, true infralateral surface, and this is the posterior surface. This is the posterior surface. Now, in this bladder, what we have done is we have cut the bladder to show the interior of the urinary bladder. If you see the interior of the urinary bladder, you can see lot of mucosal folds. You can see the lot of mucosal folds here. You can see the mucosal folds. A lot of mucosal folds are there. Okay. Now, if you see on the posterior aspect, there is a triangular region. There is a triangular region which is known as a trigone, where there are no mucosal folds and is smooth relatively. So, this is the trigone. This is the trigone. So, in the trigone area, you can see here the opening of the ureter. The opening of the ureter. This is the opening of the ureter. You can see here, and then you have the urethra. So, this triangular structure is known as trigone. So, I'll put some light and then show you. So, you can see here, this is the trigone. This is the trigone. I'll use magnifying lens. You can see, I'll use magnifying lens and show you the trigone of the urinary bladder. So, you can see the trigone of the urinary bladder. Okay, very clearly you can see the trigone. This is the trigone of the urinary bladder, the smooth area on the posterior inferior aspect, the trigone of the urinary bladder. Now, this trigone of the urinary bladder is very important structure, what you should know. Okay. So, you have the urethra downwards, okay, and then you have the opening of the ureter, the opening of the ureter. So, you can see the opening of the ureter, opening of the ureter. So, you can see the opening of the ureters here, one ureter here opening, and the other one is opening here, and this is the internal urethral orifice. Okay, this is the ureteric orifice and this is the urethral orifice. Okay, thank you.